Welcome to the Kaplan Medical videotapes for Pharmacology. My name is Lionel Raymond. I work in forensics. I'm affiliated with University of Miami. I give various classes with Kaplan Medical, biochemistry, molecular biology, pharmacology, and pathology. And today on this first tape we are going to start talking about the vast discipline of pharmacology, all the drugs that we need to know about in order to treat disorders. And importantly, the first thing you need to have an idea of is what would be the highest yield type of topics you might find on your USMLE Step 1 exam. When you look at pharmacology, overall there are two types of pharmacology questions to think about. Some are the straight recall type, where you associate a drug with a mechanism of action or a drug with a specific toxicity or side effects. Those tend to be fairly easy and tend to disappear progressively, being changed to questions, as you know, that are more integrated, that are more likely to show you a pathology type of vignette, and for which, unless you understand what's going on in the vignette, what type of disorder is being presented to you on this exam question, you may be in dire need then to figure out the name of the drug you might want to use for this, and then the question in turn might be about some side effects of that medication, what we call double jumps. As far as the setup for your syllabus, you will find that there are several units in the pharmacology book. The first units in the syllabus are the ones that are highest yield, and we'll start in order with general principles. After general principles, we'll look at the autonomic nervous system, and the autonomic nervous system is really the highest yield portion for your exam. In the ANS, this is where you'll find the most problems, the most physiopath type of basis for drug use. It's the part that we'll have to understand the best. Now, ANS will often see a great application in your third unit, which will be that of cardiovascular drugs. After the cardiovascular drugs, after those first three units that have a lot of basic concepts and lots of physiopaths behind them, then we'll enter another two major units of your pharmacology, the CNS section and the antibiotic section. What you will notice, certainly in the CNS section and in the antimicrobial sections, will be that their straight recall is often your biggest job, a lot of memorization. Beyond that section of antimicrobials will be several small sections, and those small sections are basically a miscellaneous component of your syllabus. Tons of points that we can no longer call low yield in the sense that they are often tested, but they're generally straightforward. They're points that you should already know. For instance, if I was asking you right now, what is the mechanism of action of aspirin? I hope you would be thinking immediately that, oh, this is a cyclooxygenase inhibitor. And importantly, if I was asking you in turn, how does it inhibit cyclooxygenase? Hopefully, you've came up with the fact that it's an irreversible, a non-competitive inhibitor of cyclooxygenase. If you have managed to do this, this is the kind of work we'll do towards the end of the pharmacology review. So to start with, we are going to look at the general principles section. Section 1. General principles are pretty much set in two units, the pharmacokinetics of drugs and the pharmacodynamics of the drugs. In your first section of pharmacokinetic, if you look at the diagram entitled drug disposition, you will see that pharmacokinetics will deal with how drugs are handled by our body. In the pharmacodynamic section, we'll see how binding to receptors allow certain responses to drugs. In the drug disposition diagram, you will see at the top of your diagram that drugs can be administered by a number of routes, whether IV for intravenous, PO for oral, potentially parenteral intramuscular, maybe by inhalation, many different ways to allow drugs to enter our body. The first step in pharmacokinetic will therefore be for the drug to reach the systemic circulation, and to reach the systemic circulation from the site of administration will be what we call the absorption of the drug. Absorption will therefore refer to the drug reaching the plasma. Once the drug has reached the blood, well, you know that most drugs don't work because they are in the blood. maybe with a notable exception of being certain forms of anticoagulants like heparin, or you could think of an anti-malarial drug like quinine killing plasmodia in red blood cells. But for most drugs, a critical aspect of pharmacokinetic is for that drug to actually reach the tissue. This is what you see in the central portion of the actual diagram. And in the central portion of the diagram, you see the phase of distribution to tissues. In that phase of distribution to tissues, we'll deal with two forms of the actual drug. A form that is referred to in this diagram as the bound drug, which is in equilibrium with a form called the free drug. Now, bound drug and free drug refer to protein binding of this chemical. When a drug is bound to protein, you could imagine the size of that chemical. And anything bound to protein has no business leaving the bloodstream and getting into tissue. Effectively, bound drugs are trapped into the bloodstream. Distribution to tissues, therefore, only occur with the free drug. This free drug, once it gets into the tissue, on the diagram is shown to you either on the left being stored in those tissue. Once it's in the tissue storage mode, if it's in the adipose tissue, you may not expect any CNS effect of that drug. On the right-hand side of the figure, you see the drug having distributed to tissues to very specific targets called receptors. When a drug is bound to a receptor, you expect a response from the receptor binding. And it is those responses that we'll call pharmacodynamics in our second section of the general principle. Those responses, of course, can be good, the ones you are expecting to see, the ones you want to use for therapeutic purposes, or those responses might be side effects, maybe potentially dangerous side effects. And those are still generally associated with receptor binding of drug. After absorption into the plasma, distribution into tissue, hopefully finding some receptors to bind to give responses, the body's response to a drug itself is going to be to try and get rid of it. Pretty much imagine that all drugs are foreign to our body, and the body's purpose when it sees something foreign is to really destroy it and discard it. In pharmacokinetics, the first step for discarding the drug will be that of metabolism, shown at the bottom left corner of the diagram. Drug metabolism, by far, when it comes to exam question, will deal with liver function. It is in the liver that you'll find most of the key enzymes, such as cytochrome P450s, that will metabolize drugs. Certainly, metabolism is not limited to the liver, and as the diagram indicates to you, the lung can metabolize, the blood has circulating enzymes such as esterases, maybe, to metabolize drugs. In any tissue, you will find enzymatic ways of trying to metabolize drugs. Final way the body is going to eventually get rid of the drug's effects will be to excrete those metabolites, or the drug itself. And if we think liver for metabolism, we certainly should think kidney when it comes to drug excretion, to drug elimination. Just like we said, the liver was not the only place to metabolize drug. The kidney is certainly not also the only place to eliminate drugs. Drugs can be eliminated by biliary excretion. This tends to happen for fairly lipid-soluble compound. Drugs may be gaseous in form. Think of general anesthetics, and obviously then you can breathe them out. So exhalation could be a form of elimination. And for us who work in forensics, there are many other ways of eliminating drugs. You might find drugs in saliva, you might find it in sweat, you might find it in hair. So endpoint, pretty much the drug eventually will make its way out, either as the drug itself or as a key metabolite of that drug. Well, if we summarize this diagram, there are really four phases to pharmacokinetics: the phase of absorption, the phase of distribution, the phase of metabolism, and the phase of elimination. And what we propose to do in that first section is to review each of these events separately and see the key physical chemical characteristics of those four phases of pharmacokinetic.